Welcome to week 2 of HSVC 495. An important part of human services work is what happens after a project is over or after we finished helping somebody, and that is evaluation. So we hope that by the end of this lecture, you will be able to define monitoring and evaluation and explain the difference between the two. Explain the levels of evaluation in human services practice, know what indicators are and how to develop them and how to measure them, describe the steps in the use of data in program evaluation, and list and describe the elements of a program evaluation plan. And you'll be developing a program evaluation plan as your first assignment in this course. So it's important to pay attention to this lecture. First of all, how do we define success in a human services program? How do we know that our program has been successful? Some examples might be that a client enjoyed the service, that they liked the worker they were working with, that the program achieved its objectives, that the right number of people were provided with services and the right kinds of people, that clients acquired new skills and knowledge and then they demonstrated and applied them, that the client's problems that they originally came in with have improved, or that the issues in the community that we serve have gotten better. So that might be some of the ways that we define success. But how do we know that we've been successful? How do we know that this happened? So that's what the topic of this session is, how we measure success in our programs. And these different measurements are referred to as monitoring and evaluation activities. So let's start out with monitoring. What is monitoring? So monitoring is the process of gathering routine data on key aspects of our program and then using that information to make decisions about the program. We also use that data to report to others about the program. So monitoring questions are usually more quantifiable or answered by numbers, but not always. So for example, what activities or services did we provide? To what extent did planned activities actually get implemented as we planned them? Who is being served? When are they served? How often? How long? In what context? How much are we spending? And are we spending at the rate that we expected? And did we reach our client targets last year? So these are kind of routine questions that agencies ask themselves in order to monitor their programs. Now evaluation is a little bit different. Evaluation is more related to research or study or experiment. It involves a systematic, objective analysis of a program's outcomes and impact in relation to its objectives. And it's concerned with quality of the program, effectiveness of the program, and the value of the program. So the questions that we might ask if we were conducting an evaluation is, were our services successful or effective, as we said earlier? Did clients achieve the results we hoped they would? Are we making a difference in the lives of our clients? Or how does one program compare to another in terms of effectiveness and efficiency? So these are all evaluation questions, and as you can see, they're a little bit deeper and more complex than the monitoring questions. So let's look at the difference between monitoring and evaluation. So for example, monitoring is done routinely. Sometimes we have weekly reports or monthly reports or quarterly reports. It's ongoing information gathering. Whereas evaluation happens just occasionally. It might happen in the middle of implementing a program, at the end of implementing a program, or at the end of helping a client. So it doesn't happen as routinely. In monitoring, we're tracking what we're doing. We're providing oversight with what we're doing. Whereas evaluation is more either very deep assessment or research into what we're doing. The purpose of monitoring is to track our progress and report on our progress and adjust activities as needed as we go along. Whereas evaluation is to determine the effectiveness, cost effectiveness, relevance, impact of our work with the overall goal to improve our programs. With monitoring, we focus on inputs, what resources are we putting into the project, activities, and outputs. Whereas evaluation is looking bigger at outcomes, big organizational objectives, cost effectiveness. And to get information for monitoring, it's usually routine data collection systems like client progress notes or data we enter into a patient information system. It might come from meetings, progress reports. Whereas evaluation, we are actually designing instruments, usually surveys, we do key informant interviews or conduct focus groups. So it's something outside of the routine in the way that we're gathering information. So when we're thinking about evaluation, it's a new way of thinking, from the monitoring, which is what are you doing, what activities you deliver, who participates, to so what difference are you making, what results were achieved, who benefited. So we're going from activities to outcomes, and outcomes is what we're concerned about with evaluation. So there's 4 main purposes of evaluation, or 4 main reasons why we do evaluation activities. One is to be accountable. So we want to make sure that what we're doing is worthwhile and effective, that its cost benefit is good, that the program is valuable, and we want to be accountable to the stakeholders, the clients and consumers, the community, funders, government, that our programs are effective, that the money we're spending on our programs is for a good reason. We also evaluate in order to improve programs. If you don't know if you're being effective or not, you can't improve your program. So we want to be able to enhance the quality of our program, to manage our work more effectively and efficiently. And so the only way we can do that is to evaluate if what we're doing is working in a cost-effective way. We also evaluate to gain knowledge, to gain new insights. So it's part of evidence-based practice to see if there's evidence that what we're doing is working. So we want to add to the knowledge base of the profession, so sharing success stories and best practices, and just building the overall knowledge base of human services. Also, we evaluate because we want to have good oversight of our programs and be in compliance with rules, regulations, mandates, and other expectations. And in addition, there's an ethical reason to do evaluation. If we are providing services that we don't know whether or not they're effective, or providing services that we're not sure about, then that's really unethical. We want to be able to provide the best services possible to our clients. So there's 3 levels of evaluation in human services practice. The first level is the micro level or individual practice. Was your work with a specific client effective? Were the client's goals achieved? Was the client satisfied with the service? And then there's the meso level or the group practice level. Was a treatment group, education group, or task group successful? Were the group goals met? And then there's the macro level practice, which is program evaluation, where we're asking, were the organization's or the program's goals met in a cost-effective way? So we're not looking at just how effective we were with one client, but how effective we were with a large group of clients. And within these levels of evaluation, there's also different types of evaluation. There's the evaluation that happens before we start a program, and that's called a needs assessment, where we're determining if a program is needed and what type of a program is needed, what kind of gap is there in services. Then there's what's called an evaluability assessment, where we're looking at a program to see if it's even able to be evaluated. Are there clear goals for the program? Is there a clearly defined intervention? And is the agency ready in terms of all the resources that are needed to conduct an evaluation? And then once we get to the actual evaluation, there's two different kinds of evaluations. There's the process evaluation, in which we're looking at what is the process of providing help. How is the intervention carried out? What are the steps in the process, and are we doing it in the way that we had originally planned? And then outcomes evaluation, which is what we're going to be focusing a little bit more on, was the program objective? Did it achieve its outcomes? Did it set out to achieve what we hoped to achieve? So let's break down the words program evaluation, or the phrase program evaluation. First of all, what does the term program mean? So program is the object of the evaluation. It's a direct service intervention, a community mobilization effort, a research initiative, a surveillance system, a policy development activity, a communication campaign, an infrastructure building project, a training or an educational service. It's any, I can't use the word to define the word. It's any group of activities that we do in a comprehensive way within an organization. So we might have in a human services organization a volunteer chore services program, and a homeless advocacy program, and a hot meals program. So these are all separate programs within the organization that could be evaluated. And so what is outcome? If we're looking at doing an outcome evaluation for our program, what are outcomes? An outcome is the change that occurs as a result of our activities and investments. So if we're looking at outcomes, we're not looking at how many worms a bird feeds its young, but how well the fledgling flies. So the worms are sort of the inputs that we put into the bird, and the outcome is that it will fly, if that makes any sense. And why are we evaluating outcomes? Well, let's see if we can figure out from this quote. Don't accept your dog's admiration as conclusive proof that you are wonderful. So this means you can't just evaluate a program on the basis of someone saying it's good. If you just say to each other at your work site, oh, that program is really working, that client seems a lot better, that, is not conclusive proof that you are wonderful, that your program is working. You have to show evidence that it is successful, and you have to base that evidence on measurements that you've agreed upon. So let's look at the steps in the evaluation process. First, you need to define or describe the problem or the program being evaluated. And then you need to determine what indicators you will use to answer your evaluation question. So how will you measure the success of your program? Then you need to select the data collection and analysis methods to be used. So you figured out how you're going to determine whether your program is successful. Well, how will you collect the data to show that? Then you're going to plan and implement the evaluation, and then examine, evaluate, disseminate, and use the results. So we're going to go over each of these aspects one by one. And this is what you'll be doing when you're developing your program evaluation plan. You'll at least be doing the first 3.5 of these. So first, you want to define or describe the problem and or the program being evaluated. What is the problem or need that is being addressed by this program? Describe the details of the program that is trying to address the problem. And what are the goals of the program? What are the hoped for expected outcomes? And from all this, you're going to develop an evaluation question. So to identify key questions that the evaluation will answer, who wants to know what about this program and why? In simple terms, evaluation answers 3 questions. What did we do? So what? What difference did it make? Now what? What could we do better next time? And there's a handout in your module that has some sample evaluation questions. Also, the article Planning a Program Evaluation by Taylor Powell has a list of sample questions on page 5 of that article. So look at those examples when you're thinking about your own evaluation question that you're developing for your program evaluation plan. Next, let's talk about indicators. An indicator is actually a piece of information or evidence that will tell you or will represent the outcome you're asking about or the phenomenon you're asking about. So what is an indicator of fire? Smoke. What is an indicator of academic achievement? A passing grade. So we're going to talk a little bit more about indicators and how we can determine what good indicators are to measure our outcomes. Indicators can seem kind of vague or complicated, but let's look at another example. Say you moved to a new town 6 months ago. You have 3 children in school, and you're concerned about how they're adjusting to their new school. What are some things you would look for to determine how they're doing? Well, you might look at their scores on tests in school. You might look at the number of activities or sports teams or clubs that they've joined. You might look at how many friends they've brought home or how many sleepovers they've been to. All of these are indicators that they are adjusting well to school. So it's not really that mysterious. Indicators are just evidence that you look for to see if something is working. So often indicators are expressed as numbers or percentages. Number of clients served, percent of clients who sought services, incidence of a particular illness, etc. But however, not all indicators are numbers. Not all indicators are quantitative. Some are qualitative, and they can be just as important. So in this picture, you see 5 kids, but what's really important about the kids is not the number of kids, but the quality of the kids. They're 5 happy kids. And so sometimes what you're looking for in terms of indicators or evidence is something qualitative, something related to feelings or something much more detailed than a number. And we'll get into this a little bit more because it is a little bit confusing. So let's look at the difference between qualitative and quantitative indicators. Quantitative indicators, as we said, are quantifiable. They're numbers. They're data that can be aggregated, averaged, and compared over time and across projects. They're numerical, and so they can be very precise, and this leads to a better agreement or interpretation of data. And numbers are very important for making predictions and generalizations. Qualitative indicators are more descriptive. They capture things you cannot count, like those happy faces, issues related to context, perceptions, experience, and motivation. And these are all very important things in the human services. Qualitative indicators can explain the process, how or why a program worked, or unintended and unanticipated outcomes. They supplement the numbers and percentages with a much deeper and richer information that brings to life the thing about outcomes. So while quantitative indicators will tell you how much, how many, how often, qualitative indicators will tell you more about how well something worked, including attitudes, judgments, perceptions, motivation, etc. They can help you answer the why. For example, why are some clients able to apply skills learned in an alcohol education class and others are not? The limitations of quantitative indicators or number indicators. Our numbers may not tell you the whole story of a positive or negative impact. For example, the human services workers may be offering the services they're supposed to, but they may be rude or insensitive towards clients. They can lead you to feeling overconfident about how successful your program is. Here's another example of where numbers may not be that helpful. So if you're looking at how many people you served at a drop-in program, and you think that that is really telling you something, but some people only come for 1 hour. Some people come all day. Some people come 1 day a week. Some people come 5 days a week. Some people come for 6 months, some people don't, some people just come for lunch, some people participate in all the activities. So just having the number of people served is not really telling you the success of your program. You really need to dig deeper to determine the success. With qualitative indicators, they can have their own limitations. One is that they're much more resource intensive, much more difficult to collect the data, and much more difficult to interpret the data. And we'll take a look at what are some quantitative and qualitative indicators so that you can get an example. So here's some examples of quantitative indicators. If your outcome that you're looking for in your program is that you want to reduce substance abuse in your clients, some quantitative indicators that might help you are your analysis results of clients over time or the number of client relapses. These will tell you if clients have reduced substance use. Let's just take a look at what the qualitative indicator for that would be. The qualitative indicator for reduction in substance abuse might be clients' self-report of substance abuse. And so that may actually not be as reliable in this case as the numerical or quantitative indicator. So for the outcome we're looking for in our parenting skills class is that clients are learning effective parenting skills. Here's some quantitative indicators. The percent of participants who scored 80% or more on a test in the class, a comparison of pre or post-test results. So in this case, if you're looking at parenting skills, someone taking a written test about parenting skills, that may or may not really show that they are successful. That's really just showing that they know the right answers to the questions. So here you would want a qualitative indicator. So if you see outcome number 2, clients learn effective parenting skills, here is a qualitative indicator. Parents observed implementing skills using a checklist and agreed upon definitions of skills by observers. So here you're observing the parents interacting with their children, and you have a checklist that shows what effective parenting skills are, and you're observing them to see if they meet the checklist. Now this would actually be a better indicator of whether their clients have learned effective parenting skills than just taking a written test. Here is another outcome, number 3, that you've had a successful outreach campaign in your organization. So say you tried to inform people about services and you've gone out and mobilized the community. How can you know if that outreach campaign has been successful? Well, here are some quantitative indicators. Percent increase in new clients requesting services might be one. The number of times a program is mentioned in the media means that you've gotten the program out a little bit more. The number of new agencies making referrals to your program also means that your outreach campaign was successful. And let's look at a different kind of qualitative indicator, not related to the outreach campaign, but this is one that you would have a hard time getting a quantitative indicator for. Outcome number 3. Increase self-confidence among clients receiving counseling services. So one of your goals is to increase the self-confidence of your clients. So then you might use a reliable and valid tool around confidence. So client self-assessment of confidence increases over time. So you would implement this tool at the beginning of services, maybe in the middle of services and at the end of the services, and you would see hopefully that the client's responses show an increase in self-confidence. So those are some examples of quantitative and qualitative indicators. So just some general tips about indicators. Often when you're conducting an evaluation, just one indicator is probably not going to be enough to tell you if the program's been successful. You may want to combine some quantitative indicators and some qualitative indicators. And you want to make sure that the indicators are culturally appropriate, that kind of the evidence you're looking for is appropriate to the culture. So one typical example is the client appears confident because they're making eye contact. Well, eye contact is not always an appropriately cultural activity. And so that would not necessarily be a culturally appropriate indicator, because for some cultures, making eye contact is considered rude. So you have to think when you're developing indicators that you want to make sure it's appropriate to the group that you're looking at. And you should be involving key stakeholders, clients, and others in the development of your evaluation plan, and they can also help you to figure out what appropriate indicators are. So we've talked about kind of developing an evaluation question after we've described what our problem is, and developing indicators that will help us to answer the evaluation question. So once we've done that, we need to figure out how we're going to collect the data and analyze the data. So we need to come up with data collection analysis methods. So the methods we use will depend on the question. We may have to develop our own instruments or tools, or we might use existing tools that have already been validated in other studies. So there's like the Beck Depression Inventory, or the MMPI, or the Myers-Briggs test. They're all different kinds of instruments that measure different things in people. We'll want to pilot test the instruments and the method to make sure that they're going to work for our particular intervention and population. And you'll need to plan for how you'll collect the data, who will collect the data, and who will you collect the data from, how often, where. There's a lot of different logistics to figure out when you're doing an evaluation. And then there's the ethical issues. How will you make sure that the clients are not coerced into providing the information or participating in your evaluation? And how will you ensure that client confidentiality is kept when you're collecting information? So there are 4 steps in the whole data process. There's developing the data collection and analysis plan. That's the methods and the instruments you're going to use. Then you collect the data. You analyze the data and report on the data. And then, very important, you actually use the data to do something to either change your program or improve your program. So these are some common data collection methods when you're conducting an evaluation. You may do a survey or a questionnaire with clients. You may conduct a focus group with a group of clients or stakeholders or community members. You may do key informant interviews where you pick out representative people from the community to do in-depth interviews with. You may do observations, like we talked about earlier with the parenting skills, where you observe what clients are doing or how a meeting is being run, and you have a checklist that helps to guide your observation. You may do an expert review of client notes or patient records. You may do some kind of visual recording. You may look through diaries or journals or activity logs. You may do some kind of document review analysis. You may do some kind of pre and post test, so that might be either a knowledge pre and post test or some kind of, like we talked before, like a self-confidence self-assessment or depression inventory before, during, and after treatment. You might use existing data like demographic or census data, medical records, registration forms, attendance logs. You may do some kind of self-report of the client, or you may do some kind of measurement. So if you're conducting a diet and nutrition program, maybe weight loss would be one way of measuring if your program is successful. So there's many different ways to collect data to determine how successful a program is and to answer your evaluation question. And just like with indicators, having more than one indicator is often better to have more than one method to collect data because they can sort of validate each other. So, for example, maybe for one particular program, you would do all these different things. You might look at a log of activities and participation, so how many people participated and what did they participate in. You might also have some questionnaires for the clients after each activity they participate in. You might also do some in-depth interviews with key informants to get deeper information. You might have a checklist to observe the activities, and you might do a greater survey of more clients. So this could all be for one evaluation. When you're considering what methods to use, this is what you should be thinking about. The purpose of your evaluation. Will the method allow you to gather information that can be analyzed and presented in a way that will be credible and useful to you and others? And then, as we talked about before, you need to think about who is going to be responding to your questions, or who's going to be, giving you the data. What's the most appropriate method considering how the respondents can best be reached, how they might respond, literacy and cultural considerations. So, for example, if you have a group that is not, for example, English does not, maybe an immigrant group who doesn't speak English well, you would not be giving them a written questionnaire in English. So these are just lots of different things to think about. Also, you want to consider what resources you have available. How much time, money, and staff do you have to design, implement, and analyze the information? What can you afford? Data collection can be very expensive, so you should not be collecting information that you're not going to use. And you also want to consider how the collection of data and the evaluation activities might interrupt the program or the participants. So what method is likely to be least intrusive? And then if you're going to be picking, developing tools or selecting tools that are already in place, you want to think about reliability and validity. So will you be measuring what you think you are measuring? So for example, using client satisfaction as an indicator of the success of an absence-based substance abuse program. Well, whether or not the client likes the program or not is not as important as whether or not they're not using drugs or alcohol. So, I mean, of course you want them to like the program, but they might like the program and still keep drinking or using drugs. So you would want to use relapse rates, for example, or the urinalysis tests that we talked about earlier to determine the success of the program. And then reliability is also important. If something was measured again using the same instrument, would it produce the same results or nearly the same results? So say you give a personality test like MMPI to a client, and every time they score differently on it. That might be a product of the test not being a very reliable test. Something that would be reliable is to say you had several observers watching the same activity and they gave similar ratings. That would mean that whatever instrument they're using and whatever training you've given them to using the instrument has produced a reliable tool. So here is a source for psychological assessment tools. As you're thinking about how you want to measure the success of your program, you may consider some of these tools. Our library has a database called APA Psych Tests, and it includes tests that were developed for research, and they provide a lot of information about the tests, detailed test records that include summary background information, development history, purpose, reliability and validity data, etc. So some examples of the kinds of tools that you will find there are a child depression inventory, an ADHD screening questionnaire, a quality of life inventory, or a social activity log. And so you can use some of these tools to measure how successful you are with individual clients and with the program in general. So once you've figured out your data collection methods and tools and come up with a plan for how you're going to collect the data and who's going to collect it, and then how you're going to analyze it and who's going to analyze it, then you want to actually finish out developing your whole evaluation plan and implement the evaluation. Now you want to make sure that the leadership of your organization is on board with the evaluation. You need to sort out all the logistics of how the evaluation will be conducted and how it will be paid for, developing a timeline and a detailed work plan or activity plan for the evaluation. You need to provide training and orientation to the evaluators so that they understand the purpose of the evaluation, the methods, what kind of tools they're going to be using, how to use the tools, what they're looking for in the evaluation. And you want to make sure that the people that are being studied or the people who are working in the program that you're studying, that they are all aware of the evaluation and have had some input into the design of it and the data collection and even the interpretation of the results. You want it to be a very collaborative process. Now, here are some things that are barriers to evaluation, that are problems in evaluation. If the leadership is not behind the evaluation, if you do not have the time and resources to do the evaluation, if you have people who are not very skilled in data collection or data analysis, or in any of the other processes of evaluation, or if you feel like our program really can't be measured, it really can't really measure the essentials of our program. There's also fear that people have when they know their program is being evaluated. They fear that maybe if the program does not appear successful, they might lose their job, or things might change, or somehow it will hurt the program. So when you're preparing for evaluation, you need to reassure people that what you're looking to do is help to improve the program, not to hurt the program. And sometimes other barriers are lack of or poor evaluation questions, tools, or bad data that you've collected. So once you can finish the evaluation, you want to examine the results, evaluate the results, or analyze the results, disseminate the results, and then use the results to improve the program. So you want to analyze the data and write some kind of report. You want to also evaluate the evaluation process. Did it go well? What were some of the problems? What would you do differently next time when you're doing the evaluation? And you want to make sure the evaluation is not ignored. You want to get the information to the right people, present it in time to be useful, so don't present it like a year after you've conducted the evaluation. And then use the results. Whatever the results are telling you, you should use them to improve the services that you're providing. And you want to communicate both the results and how you're using the results to the community, to the client group, to the people at the agency in a timely manner. So there are different ways to disseminate your evaluation results. You can write a report. They're usually pretty long, but you always have a short summary at the beginning. You can develop some success stories or some kind of short impact statement. You can do a press release, a media appearance, depending on how important your program is, some kind of public meeting where you share all the results of the evaluation with all the stakeholders. You can send it out in a memo or an email, in a newsletter or a brochure. You can do some kind of display in your agency that shows that you did evaluate the program and what the results were, or you can do some kind of audio-video presentation. Now, we talked a little bit about making sure that your evaluation question, your data collection methods, your tools, all these were culturally appropriate. So let's talk a little bit about the overall issue of cultural competency and evaluation. As we know, cultural competence is an ongoing process of both learning and unlearning. And it includes respect, self-awareness, self-examination, and acknowledgement of your own values, biases, and misconceptions. Culture will shape the kind of evaluation questions you ask, how you design the evaluation, how you collect data, how you analyze data, and how you interpret data. So you should include the client population in both the staffing, the design, the instrument development, the pilot testing, the data collection and interpretation, and the dissemination of your evaluation. Consider language and content and context of the instruments and of the data collection. And consider the power dynamics. If you are somebody's therapist and you are asking them to participate in an evaluation, they may feel like they don't have a choice. So we need to really make sure that our clients feel like they have the choice whether or not they want to participate. And of course, you want them to participate. You want them to see the benefit of it. But you need to make sure that they don't feel like they are being forced to participate. Another issue of power dynamics also includes like who is conducting the evaluation and how confidential will it be. I once participated in an evaluation where we went around to different health clinics, and the director of all the health clinics for the county insisted on coming along and being part of the evaluation study. But people did not trust her, and they did not want to tell her things. And so she made it very difficult for us to have a good evaluation process. So you need to really consider the power dynamics when you're thinking of your evaluation plan. Use approaches that are appropriate to context and culture. So, for example, you might want to, instead of having a written consent form, you might have to have a verbal consent form, or something that has more pictures than words when you're working with a group that has a oral tradition, or high levels of concern about privacy, or low levels of literacy. You want to make sure that all the findings are accessible to stakeholders. So you want to not just send a big, thick, 100-page report. You may do a slideshow of the results, or you may translate a condensed version of the results into whatever language of the stakeholders is. And consider unintended consequences for reporting the findings. How might the results be perceived by the community, and will that be positive or negative? So this is just a quick review of kind of the steps of culturally responsive evaluation. You want to prepare for the evaluation, engage stakeholders in even conceiving of the evaluation, identify the purpose of the evaluation, frame the right evaluation questions, design the evaluation, including what indicators you will be looking for to make sure you can answer the question. Select and adapt the tools and the data collection methods. Collect the data, analyze the data, disseminate and use the results. And this is the steps that you will be using as you are working on your program evaluation plan. And here are some references that might help you. There's many resources in the course module, but here are some additional references that go into more detail about evaluation.